It's all over every front page. So Labour have come into office and they said immediately to this guy who used to be involved in the health service, we want you to give it the once over. It's a very, gosh, I wish all reports could be this quick, that's for sure. The Chilcot inquiry into the Iraq war took 7 years. This is about 7 weeks. NHS must reform or die. NHS getting more money, doing less. Labour orders biggest reform. Let's go through this. They say they can do it in a decade. Labour. Express, no more sticking plasters. Guardian has really bleak headline here. Thousands dying. Then we've got NHS shake-up biggest since 48. And then Starmer warned the ailing NHS is in critical condition. So all slightly different angles on it. But essentially what's happened here is Labour have had a look. They say it's in a terrible state. They say they can fix it. That's the key thing. So we'll talk about the key issues the reporters highlighted in just a moment. We'd love your thoughts, though, on what you make of the ability of this government or any government to fix the NHS. I'll start with you, Lynn. Can any government do it?
I think that he's going to have to make some hard decisions. There was this massive conversation when the Conservatives were in power that the Labour Party, the Conservatives are going to be the ones to privatise the NHS. But it was actually Labour that introduced a part of privatisation with the PFI contracts. And I think I wouldn't be surprised if Keir Starmer has to introduce something that really tightens the financial belt of the NHS. Now, when people say, should the NHS receive more money, I would say no. They receive loads of money as it is. They waste loads of money. I think what they need to do is they need to get the auditors in and really cut back where is essential. I said this previously when I was on here. They spend millions a year just to change their emails. I pointed out you've got
to pay for auditors, and it's yet more managers walking around in suits.
That's the problem.
But so just quickly, we're going to go to our break, so we'll come back to this, I promise. Do you think Labour can fix it in 10 years?
Yes, but it's going to mean stripping everything back and rebuilding it, using the talent of the people who work within the NHS, not the managers, not the people who've come from other industries and tell the nurses and the doctors what to do, but it has to be restructured to suit, fit for purpose, to suit the ability and the needs of those who work within the system. OK, well, let's talk about this after the break. Can Keir Starmer save the NHS? They've, if you like, diagnosed the problem, which is massive, but they say it's not dead yet. And he's also said, by the way, he won't put up taxes to give more money to the health service. What do you think? We'd love your calls, 0207 862 2222. Can Keir Starmer save the NHS? We'd love your calls, 0207 862 2222. Now, we're asking this after the release of a major report into the state of the NHS by surgeon and former health minister, Lord Darzi. And let's just have a look here. There's two elements to it. There's what's wrong with it and what can we do? And we'll sort out here what's wrong with it. Can the NHS be fixed? I've chosen a gymnasium for our hospital beds because we couldn't find an empty ward. So each of the patient notes here on the end of the bed we'll take a close look at. These are the things he says are going wrong. Let's look at the first one here, low spending. So he says that the 2010s were wasted, the Conservatives didn't spend enough. They had rises, but very small, 1% on average, and that means the NHS basically ground to a halt. Secondly, delays in A&E. Now, here's the thing. In 2009, at A&E, 40 people in the queue ahead of you. Now it's more than 100. Mind blown by that. That needs sorting out. And, of course, doctors, people going to A&E instead of the GP. More ops acts than in rival countries. We're cancelling an awful lot of operations, including some that are life-saving. Some people being told you can't have your operation and you will die. He says, this is our fault now. This is the public's fault. We've grown sicker in the last 10 years. We've got lots of long-term conditions. Children's health has worsened, etc. So then cancer mortality is going in the wrong direction. Yes, we're getting better at people surviving cancer, but not as fast as other countries. That's a problem for us as well. We're nearly there. There's basically 8 different things he's highlighted. Of course, he talks about the fact that if you're in touch with the NHS, they're going to write you a letter instead of sending an email. And some people say they're still using fax machines and they haven't gone digital and all the obvious stuff. That's a problem too. Couple more. We have a problem with heart health. We have people whose hearts are poorly and they don't get treatment in time, and that's putting us in reverse.
And the second one, he takes a dig at a guy called Andrew Lansley, who was Health Secretary. And Lansley created something called the Health and Social Care Act, massive reorganisation of the health service. It was said only two people understood it, Lansley and somebody else, and they must never travel together, because if they were both wiped out in a day, we'd lose track of what was going on. So that was a whole complicated rebuilding of the NHS. And I suppose the worry here, Carolyn, is that you come at it the same way. You have a big scheme, a big plan, and the poor old NHS has 10 years working out what you want it to do.
Well, first of all, I'd say it's down, but it's not out. And there's still an opportunity to save it. But to save it, we have got to reform. We've got to look more to put in the NHS into community. We've got to look more to the people who work in it to get their advice. We have to invest, but we have to invest in reform, because more staff doesn't necessarily mean more operations.
It's getting more money than ever. It's not. Cause
well,
I support Chelsea, right? You support Chelsea.
So do I.
So you're okay. Well, that's brilliant. So you will know that flooding things with money doesn't always win games.
Exactly. But if you reform, if you spend the money on reform and actually build in a structure which works for communities, which works for the staff, which works for the system. I mean, we mentioned private companies. I've used private healthcare. I've used private healthcare for my menopause because I couldn't get the right treatment on the NHS.
Would you say that parts of the NHS need to be privatised? When we look at outpatients, there's 250,000 outpatients. It costs £120 and 10% are not turning up. That's thousands, millions wasted every year.
What I would say is that we have to work with the private sector, we have to copy good practice, and we have to share some aspects of it, but it must always be free at the point of delivery.
Let's take some calls on this. Zara's in Cheshire. Hi, Zara. Can they do it? Can Labour turn it around?
I hope so, but not if they carry on the way that they are. I think just the fact that we've needed a report to tell us that will have cost a significant amount of money where we're going wrong. All the nurses and doctors and patients themselves could have told you everything in that report.
It sounds like you're a nurse, are you?
Yeah, I'm currently a district nurse.
Okay.
I started 26 years ago on the wards. I had one G-grade manager above me, and then there was a manager above her. I now don't even know who most of my managers are, because there are so many.
Why? Why do we have? I don't get it.
Exactly.
Is it that it's called Parkinson's law, which is that work expands to fill the time provided, and you have a company with 100 people, and pretty soon it becomes 500, and they're not doing any more work, and it might just be that you need to prune these people, do you, Zara?
Yeah, it's just money. It's meeting after meeting. I've got colleagues who are band 7s, who are amazing nurses with 20 plus years experience, who are leaving their posts because their entire job now is going from meeting to meeting to meeting.
God, it's depressing.
But you can't blame the nurses, because the only way that they get promotion and the only way that they can enhance their earnings is by going into managerial positions. So I've got 26 years. I'm a good nurse. I'm still on a band 5 because there are no opportunities unless you go into management.
I hear you, but don't do that. Please don't go into management, Zara. We don't. I want you by my deathbed. I do not want you behind a desk somewhere. I can tell how good you are. That's brilliant. So Zara is a great nurse, and she can't get a pay rise because they expect her to want to become a manager.
There's too many managers.
We've lost the plot.
Yeah.
Zara, thank you. Bless you. Richard in Essex, hi.
Hi, good morning.
What do we do? Can it be saved?
Well, no chance of it can be saved under Starmer. He's a Tory in disguise.
Tory? Okay, every time I open the Daily Mail, they say he's Corbyn in disguise.
No, he's a Tory in disguise. He's going to privatise it like he's done with everything, everything else like the Tories want to do.
But why would that be wrong? Look, let's look at the dentistry in this country. It's folded. It's over. There are many parts of the country where you can't get a dentist, and I'm sure that's going to be a problem for Labour. They're saying they're going to fix it.
Well, yeah, but the way Labour are going to fix it is they're going to kill off as many people as they can.
Well, how are they going to do that? I see, with the winter fuel.
Fuel, the 25% off the housing. So he's out there to do what the Tories
I'll let our Labour MP answer that.
Kill us off.
Let Carolyn answer.
Well,
Trying to kill old people.
Well, hi, Richard. We're certainly not trying to kill off old people. We're trying to make a fairer society, and we have to reinvigorate the NHS. And the only way we do that was by a report in 7 weeks, not 7 years, and actually put an investment and common sense back into a system which is badly failing. And I can assure you that Keir Starmer is not a Tory in disguise any more than I am. But unfortunately, some of the media would have you believe otherwise. But
Thank you, Richard. Just on the dentistry, I just look. Everyone who has teeth in this country can tell dentistry isn't working. Now, the NHS cannot look after every single tooth in the country. No government could do that. Even if every minister was a minister for teeth, it wouldn't happen. So let's be frank and realise dentistry is over, unless you should say unless you're very poor and you need an NHS. Why don't you say it? Why do you keep promising you're going to fix dentistry? It's not going to happen ever.
Well, because it's a service that the NHS needs to provide. We need to have...
But why should I get dentistry on the NHS?
Well, you probably haven't. You probably, like I do,
Well,
pay
of course
private.
Well, of course, yeah, because I haven't got an NHS
But the problem
dentist anywhere
is
near me.
the NHS dentistry contract does not pay the dentists enough money to do the work.
Caroline,
therefore they end up going private.
Aren't you
But
concerned that with what Keir's potentially doing, let's say he has more incentives like tackling obesity, smoking, all these things, because he's decided to be more preventative, then isn't that attacking who votes for Labour, the working man, the person who may not be the healthiest? And now we're kind of victim blaming to say, you know, you shouldn't smoke, you shouldn't eat this, shouldn't eat that.
It's being pragmatic and saying that if you target the causes and you put the prevention...
I agree with it, but I don't think it's a Labour voter...
further down the line, you won't need the, you won't need the emergency
Maybe that's right.
operations.
Maybe that's right. OK, more calls. We've got loads of calls on this, whether Labour saying they can save the NHS in 10. And let's speak to Greg in Somerset. Hi, Greg.
Hello, yeah, I'm a junior doctor at A&E.
Oh, God, and you sound exhausted, if I may say so.
Yeah, well, I did weekend nights last weekend, and we did, I can't hear a thing you're saying.
No, I'm not speaking, you're speaking.
Yeah, so we actually managed to get this wait times down to 20, 30 minutes. So it is possible to run the system, but we just get a lot of inappropriate people turning up.
Well, I gather that. So you get people coming with headaches, and one headache in 500,000 is going to be, what, a brain bleed, and they're going to be dead unless you act. So you've got to take them seriously.
True. They all get head scans. They
get head scans. Well, can't you, isn't that one economy where you just turn them all away?
Well, we could take higher risks, but we're not allowed to take those risks any longer.
Well, you're going to have to, aren't you? Because the highest risk is to have a queue in A&E so long that people die in their chairs.
Well, that does happen. So maybe we need to charge £1 or £2 to attend A&E or something like that.
Or OK, well, this is great to think about this. What about breathalyzing people on the doorstep?
Well, some people have got injured, so they still need to be treated. So that's victim blaming again, like your guest said.
Yeah, but I mean, we may have to do some victim blaming.
Going back to dentistry, those people end up in A&E at 2 a.m. with tooth infections, and we're not dentists, but we still treat them.
I mean, that whole thing.
Pain.
What's the craziest one you've had, Greg, where you think this person shouldn't be here?
Well, we get a lot of people with mental health problems coming in again and again, and we've become like a mini mental health unit with people waiting for long-term placements.
Oh, it shouldn't be. I mean, bless them, but you shouldn't be in A&E for that.
The police also suffer from that. The police end up locking up people with mental health issues. And
well, the Met Police announced that they weren't going to attend anything involving mental health. Yeah. They announced this a year ago. No. Do you know how long that policy lasted? 4 minutes.
Of course. Yeah.
Because you can't ignore somebody waving a sword around or something. Yeah. Greg, so what needs to happen, Greg? Give us your one-line solution.
Just make me more efficient at being a doctor. Help me get my job done quicker. It just seems so many barriers in the way of doctors doing their job.
Hal.
Thank you, Greg. Thank you very much. Hal, what do you think?
Yeah,
I think just let him say, I'm not seeing you, you're a time waster, I'm not seeing you. I'm going to the fifth person in the queue, thanks very much.
I agree, you have to charge.
Yeah.
You may have to charge some people. Like 10% of wastage at £120 is phenomenal.
Well, no one should be in A&E more than twice a year. So you say on the third visit you pay £50. Would that work?
I doubt it. Because nobody knows how much money anybody's got, if they're available. They may have been out in an accident. And
but you can't have 3 accidents a year.
Well, you can. You could have a road accident every week, and
What about if your illness?
Well,
what about if your illness is directly affected because of your obesity, and you've been advised to slim down and be healthier, and you've gone against that?
Yeah, you can't then refuse to treat someone just because they are obese.
But they do.
But it's self-inflicted.
No, but they've done that. I'm sorry. They have said to people, unless you lose weight, you will not get this operation. Unless you stop smoking, an example. And George Best was told, we can't give you a new kidney until you stop drinking.
But if you turned up in A&E, you would be seen.
I appreciate that.
Yeah, you cannot turn up at A&E and not be seen. You have to be seen.
I did go in let's just say a close relative had a very bad fall, elderly lady in my family, and that kind of narrows it down. And she got great service at A&E. I must say they were brilliant. I won't say anymore. But I just think sometimes the trouble is that it's like trains now. If a train leaves and arrives on time, you think you've been lucky. I mean, and it's a bit like that with me. I'm thinking, oh my God, we hit them on the right day.
But the problem with anything that seems on the face of it to be free or easy to access, we don't value it. That's the problem.
Yes, you're so right.
I don't think people value
the NHS. We do value the NHS. I think the public
we go there willy-nilly for everything.
But we do value the staff.
No, I mean, we take advantage of it. I've got a sniffle, I'll go to the doctor.
We'll start charging them. Christine in Cardiff, what do you think is the solution here? Because there's got to be a big idea somewhere.
Well, I'm not sure, Jeremy, but I do know I've phoned up because Wales and Scotland are devolved, so we're not included in this discussion because...
Oh, well, they are.
Well, not really, because the Welsh Senedd actually control our NHS. And earlier in the year, on the BBC News, but it died a death, they said that they'd lost millions from the NHS funding and couldn't account for it.
What you mean? They had the money, but they just poured it down the drain. Terrible things about the Welsh NHS. What do you want to?
That's why I'm telling you, I wonder if we could get in as well, because it's pretty awful here, the NHS. And I have a very good doctor's surgery, but even they are just doing 2 or 3 days a week and doing other work. Because how can anyone cope with a system that's falling down and no one is accountable? Because certainly the Senate are not.
Thank you, Christine. I'm going to press on just because I've got to get some more points in. Sylvia in Durham, hello.
Yeah, good morning, Jeremy. Good morning, girls.
Give us the big idea.
Well, my opinion is they need to stop putting National Health Service patients into the private sector and the private sector, the National Health Service, because doctors are flipping from one expert to another. And it's all wrong. It's conflict of interest, because if you go to the private sector as a doctor, which they deserve, don't get us wrong, because I think they should deserve the world, but they get X amount of funds for doing that job. And they go to the National Health Service and they get a very small amount for doing that job.
Well, hang on a minute. They're on a salary and they have a pension.
Yeah. There's not enough doctors to only specialise for them to only work for the NHS or only privatise. That's why they have to go between.
OK, Sylvia, thank you. Christine in Hampshire, what's your diagnosis and your prognosis?
Oh, good morning, Jeremy. So I'm in a bit of a rush. Bear with me. We've just Blinken and Lammy have just pledged 600 million to Ukraine. So we know where our pensioners' fuel allowance is going. Plus the people at the post office are still waiting for their compensation. And your Labour lady there, it should be welfare, not warfare.
Sorry, Carolyn. Yeah. Sorry, Carolyn, Christine. Go on.
Well, I mean, the money that we're going to give Ukraine is by no means coming from the National Health Service. That's a completely different budget whatsoever. And do we abandon Ukraine? Do we now say, well, get on with it, we're not going to help you anymore? Of course we shouldn't. We're a country that's always helped out our neighbours who are in distress. And the NHS is in a really bad state. I'm not going to deny that. But we've been in power for 8 weeks and we have been really proactive in getting a report done and actually identifying problems and actually getting on with the job.
Do you think, Christine, they can do it in 10 years?
That lady is talking absolute rubbish. We don't need to get involved in Ukraine. America certainly shouldn't be involved in Ukraine. You can always find money for weapons and war.
I agree.
Get your priorities
You agree with
right.
that?
Oh, 100%. I
All right.
understand it does come from a different budget. However, it does not look good when our pensioners are struggling, the NHS is struggling, and we're just giving money
All
to
right.
a country that wants war.
Need
It's a
to
global
take, we
commitment
need to
to
take our
Ukraine.
10 o'clock break now, just for a moment, OK? Thanks for your calls.